Hey everybody, it's Andy Good here. Just wanted to go through the 4 main exercises that we do either following a knee surgical procedure or if you've had some patellofemoral pain, and just wanted to go over some of the common pitfalls in performance of those as far as 3 main things: positioning, pace, and time. So let's go ahead and get into it. So the first exercise that you'll see in the mat exercises is the quad set. It can be done one of 2 ways. One with the towel roll underneath the knee and having the patient tighten up the quadricep muscle. You should see the kneecap kind of raise up towards the person's stomach, and they're going to hold that for a 5-second count. If they're having a hard time with getting their knee straight, sometimes post-surgically we'll have them put it more at their heel so that there's air space underneath the knee, and have them squeeze down into that. 5-second hold, 5 seconds relax. Second exercise that you'll see is called the shorter quad. This is very similar. It's really important to get the kneecap lined up straight, toe pointing to the ceiling. You don't want them out to the side or turned too far in. It should be a nice straight line from knee to toe. And they're gonna really slowly raise up, lock out into a fully extended position for a 5-second count, and then down at a 2-second count. And it's important on pace to go up at a 2-second count, pause for 5, down slow for 2. This can be done with or without the ankle weight, so making sure that the patient is using a weight, or checking with the therapist to see if it's on the flow sheet. And typically this is done from anywhere from 2 to 4 minutes, but pace is probably the most important thing with that exercise. Or laying down flat. You don't want them sitting up and trying to do the leg lift in this position, which we see sometimes. You want them all the way down flat. Opposite knee is bent up, and that's typically to protect their low back. For some patients who have back history, you might tell them to tighten their tummy muscles as they lift. And it's not a bad idea for all patients to do that. But the goal here is that they try and keep the knee as straight as possible and not let it sag as they lift. And so you want them to lock the knee out straight, go up to the height of the other leg, pause for 3 to 5 seconds, and then down at a 1, 2 count. And then back up, 1, 2, 3, 4, 5, down at a 1, 2, and then rest for 5. And again, anywhere from 2 to 4 minutes for that exercise, which should be on the flow sheet. Last exercise is called a long arc quad, or LAQ, on the flow sheet. This is going to be in an upright sitting position where their knee is bent to a full 90 degrees, and they're going to work on the full motion now, holding to a straight, hold for 5 seconds, and down at a 1,000, 2,000 count. Probably the biggest pitfall between all exercises is that you see people move too fast and not hold for quite as long as they should. So it should really be about the kneecap tracking properly and nice good control of the quadricep muscle. So you want them up slow, pause, and then down slow and controlled. Up slow, pause, down slow and controlled. And that's your